Hello. I will be continuing to talk about heart failure, and I will continue talking about signs and symptoms. So, right-sided heart failure. So, with the right-sided heart failure, we have backing up of the fluid in the heart. So, there's a backup of fluid right here, and it backs into the venous system. So, jugular venous distension will occur, and they call it venous congestion. I already mentioned about distension of the liver and production of albumin, how it affects the ascites. Also, I drew this nice diagram of the hepatoportal system, and in the hepatoportal system, veins that bring the nutrient-rich blood back to the liver, they will have a backup of fluid, and the fluid will move out and cause again ascites. Okay. Tenderness, liver dysfunction. I talked about the edema, and that it starts usually in the feet, then moves to the ankle, and keeps going. One important note of importance. Dependent edema. Retention of 4.5 kilograms, 10 pounds, or 4.5 liters, which is 4.5 kilograms if you weigh the patient, is necessary for the edema to develop or to see any changes in person. So once they gain that, then it becomes evident. Right-sided heart failure. So we have this lady here who will have fatigue from lack of oxygen delivery or removal of carbon dioxide from her extremities. Peripheral venous pressure, increased peripheral venous pressure. That's her legs again. Ascites from backing up of the fluid. Enlarged liver and spleen, again from backing up of the fluid. Maybe secondary chronic pulmonary problems. Well, that's moving on already now. Systolic, or the left heart failure. Jugular venous distension. We talked about the backing up of the fluid. Anorexia. They will not feel hungry. All this pressure on their gut, all the backing up of the fluid will make them nauseous. Without the E. Nauseous. All the backing up of the fluid will make them nauseous, and they will not be hungry. And they will complain about the GI distress. They will weight gain from the accumulation of fluid, and also dependent edema. Also, if you but all this fluid that accumulates in the legs actually helps their heart to I know it's the reason why they have the problems, but in the treatment part, we're trying to decrease fluid in the system with all different drugs. But also, I learned if they dangle their feet and try to let the fluid be in the legs more, it makes it easier for their heart to work. Easier because there's less stress on the heart when the fluid is somewhere not moving to the heart as in large amounts. So one interesting thing. Okay, that's our right-sided heart failure. Now let's move to the left-sided heart failure. So in this case, the left side of the heart is not functioning that well. Not functioning well. It's not pumping out the necessary volume of blood to help the system, and the blood will back up into the lungs. So lungs are trying to push it. The left atrium will try to push the blood into the ventricle, but it's unable to do so. So the blood backs up into the lungs, and right here, a little diagram. So we have our arterioles and our venules. So we have our alveoli. We have our alveoli. We have our arteriole and we have our venules. So the venules bring the blood and they try to push it into the arterioles to move it into the left atrium, and the blood doesn't want to go. There's increased pressure in the atrium, it backs up and blood leaves out into the alveoli and accumulates on the bottom, which leads to these symptoms: dyspnea, O2 is not being exchanged or delivered, cough, dry and unproductive, can be symptoms of that. So you can think it's just COPD or asthma, while in fact it is developing heart failure. So these symptoms are similar: cough, unproductive, dry and unproductive, very similar. So we should be aware of all three and consider them all three when we have a non-productive cough and we have crackles, or maybe wheezes too. Then when it's come pink and frothy, sputum becomes pink and frothy, we know it's the blood accumulates in the lungs, and that's what they're bringing up. So we got crackles, decreased O2 saturation, that's our dyspnea, and we'll hear S3 on auscultation. Well, that's our heart feeling too much. That's this sound produced by the heart wall of the heart. Okay, pulmonary congestion. Okay, so there's also, the whole lung dilemma is called the backward effect or failure, backward failure, while forward failure in the left-sided heart failure is unable to supply blood to the organs. So there's decreased perfusion to the extremities. Well, that will lead to cold extremities. And also, if there's no blood supply to the brain, it will lead to these symptoms: dizziness, lightheadedness, confusion, no O2 to the brain, confusion, and it will stimulate the sympathetic response. The brain will send the alert. Oh boy. Will send the alert down. Decreased perfusion, skin pale and ashen, cool and clammy. Okay, so more of the heart, tachycardia, palpitation, and the person will be easily fatigued because of the lack of the O2. Left-sided heart failure. So the person will be confused, As you can see, he is confused. He keeps exercising with little results. He's sweating. He's sweating. Confusion. So probably the sympathetic response from his brain sends a response, and so restlessness. So he has to occupy himself with something. Orthopnea. Well, he's sitting, he's not getting enough air because of the fluid accumulation in his lungs. You can see it by his blue lips. And also blue extremities. Blue extremities. Okay. External exertional dyspnea. Every time he starts exercises, he doesn't get the O2, so he's fatigued. And our cyanosis is the heart is unable to deliver O2 and blood to the extremities. Paroxysmal nocturnal dyspnea. Paroxysmal nocturnal dyspnea. It seems when he lays down, when he is flat, his patient, the fluid accumulates so much in the lungs that he is unable to breathe. So pulmonary congestion will lead to cough. So this gentleman will cough. We'll hear with the stethoscope, we'll hear crackles and wheezes. So there we go. I talked about wheezes, and here they are. I spell wheezes correctly. Wheezes, yep. Blood tinged sputum. Well, he'll cough up some stuff. There's gonna be blood tinged. There's blood here, blood tinged sputum. Tachypnea. So his rate of respiration will be increased. So 24 and higher. Well, let's give him 30. He'll be breathing 30 breaths per minute. And we'll have to find out why. If that's the only sign and symptom we have. Okay, that was the part 2 of signs and symptoms of heart failure. And thank you for watching.